Hi, my name is Fatma Binwar. I'm PhD doctor in sciences of sport and physical activities from Tunisia, and I'm very happy today to present my research study in this international conference. So, my research study titled Pilates versus Zumba training effects on postural control in postmenopausal women aged between 50 and 60 years old. So let's start with introduction. Middle age is the most important period in women's life. It indeed involves unbearable difficulties such as worry about growing old, marital stress, widowhood, retirement, and family death. Meanwhile, middle-aged women are commonly mentioned as the sandwich generation, providing financial support and care for their own children, grandchildren, and aging parents. Specifically, at this period, women coincide with the menopausal stage that cause physical, cognitive, and even psychological issues. Let's go deeper into the problem and exactly focusing on one significant health alteration. It is posture control. Posture control is so important for mobility and daily life activities, which is the most vital factor for life quality. Unfortunately, a serious decline in women's posture bias by the fifth and sixth decade has been well documented. As a result, the percentage of falls among women aged between 51 and 60 um, were surprisingly higher than any other age groups. Besides, it has been reported that falls are the third leading cause of unintentional injury death among middle-aged adults. These falls result in fracture to postmenopausal women, which may seriously hinder their quality of life and lead to a high risk of morbidity and mortality, as well as increasing the direct cost for health service. Thus, falls prevention should be a routine in management of middle-aged postmenopausal women. Given that posture impairment is a key modifiable factor for falls, safety exercise that aim to improve posture control should be an essential component of falls prevention program in both clinical practice and research literature. One of the most common options is Pilates. Pilates is a method of mind-body training. It is considered as the most safe exercise program than other ones, reducing the risk of injury to the musculoskeletal system. This type of exercise is characterized by the activation and coordination of several muscle groups. It has been widely documented that Pilates is a highly effective activity, particularly for menopausal women, in terms of physical abilities such as postural control, proprioception, muscle strength, as well as psychological states by reducing their menopausal symptoms. However, middle-aged women are generally inactive, too lazy to follow physical activity recommendations compared to men. They prefer to rest rather than regular physical activity or exercise, which increase the rate of sedentary life tendencies. As they age, this inactivity results in serious health problems. The challenge now is how to encourage these women to take up physical activity. A proper guide should be provided here to encourage these women to set their own exercise goal. For that to be achieved, enjoyable and convenient exercise programs should be designed. Zumba seems appropriate as it presents enjoyable and effective exercise options, especially for women. It is the most popular and successful dance fitness program in the world. It involves rhythmic motor coordination, balance, and musical experience in addition to its requirement for physical activity. Scientific data showed that Zumba benefits on multiple functional, cognitive, and psychological well-being. With all what we mentioned before, we wonder which one of these two effective training programs, Zumba or Pilates training, would be the most appropriate and effective for promoting postural control in middle-aged postmenopausal women. Therefore, our aim is to explore the effect of 12 weeks of Zumba training compared to Pilates method on postural performance in these women. To achieve this aim, we recruited 57 women aged between 50 and 60 years old. They were healthy, postmenopausal for at least 4 years, with low physical activity level, mild risk for falling, and have no experience in Zumba or Pilates. And each woman had reported a high risk, a history of cardiovascular, metabolic, renal, hepatic, or musculoskeletal disorders, mental disease, severe orthopedic, neurological, or respiratory dysfunction was excluded from this study. This study was designed as a randomized controlled training intervention study in which each woman was randomly assigned to either Zumba group, Pilates group, or control group. The two intervention groups underwent 12 weeks of training program at a rate of 3 one-hour sessions per week, and the control group take part in no intervention along the same period. In this study, 3 sessions were held: a familiarization session, a two-test session, a pre-test session, and post-test session before and after the intervention program. Now let's have an idea about Zumba training program. Well, each training session initiated with a 10 minutes of warm-up based on slow and fast walking, easy Zumba elements and dynamic stretching to the beat of the music, following by a 45 minutes of the main Zumba section featuring continuous dance movements like forward, backward, sideward, waves, and spinal rotation combined with changes of directions accompanied by music like Latin, merengue, salsa, or samba. And of course, the cool down part is a 5 minute period for cool down, recovery, we walk, breathing, and relaxing. On the other hand, the Pilates exercise program was considered of 10 minutes warm-up, 45 minutes of main program, and 5 minutes of cool-down like the Zumba training session, of course. The warm-up included kinetic movements and gentle tractions of various joints. The main workout part was divided into 3 parts. During the first week, participants were introduced to the Pilates method, its principle, proper movement execution, and breathing. The second part was from week 2 to week 5. Floor exercise was performed during this period, and the third part, which is from week 6 to week 11, in which resistance exercises were added using a series of instruments like elastic bands and Swiss balls. The last part of the workout included stretching movements performed in standing, sitting, and lying position. For measurements, a stabilimetric force platform was used by recording the center of pressure means velocity values sways in 4 conditions where participants was asked to maintain an upright bipedal standing posture as still as possible for 25.6 seconds on firm and foam surface with eyes open and eyes closed condition. Let's move on to results. As you can see, we found that the center of pressure means velocity values were significantly lower in post-testing session compared to pre-testing session only for the Pilates and Zumba group in the firm surface in both as open and as closed condition. However, these improvements were significantly better for Zumba group compared to Pilates group. On the other hand, in the firm surface condition, only for the Zumba group, we found significant main changes following in the post-training session compared to pre-training session, in which the center of pressure means velocity values were significantly lower in post-training session compared to pre-training session in both as open as closed conditions only for the Zumba group. However, the control group, of course, showed no significant effect on all these sensory conditions. Following our results, both training programs have a positive impact on posture control, and these gains were better following Zumba training compared to Pilates. Similar results were found in other adults following Pilates training compared to partnered Latin dance. These authors suggested that dance training resulted in better stabilization of the body sway amplitude compared to Pilates training. According to our findings, Zumba training was effective to improve postural control in middle-aged postmenopausal women, whatever the sensory condition was. Zumba benefits on postural control has been evidenced in healthy young women and patients with Parkinson's disease, suggesting that dance training involves the integration of sensory information from multiple vestibular, visual, and somatosensory inputs, which in turn improve postural control skills. Furthermore, performing movements associated with rhythmic music has been shown to boost mood and improve coordination, proprioceptive control, and mobility, which in turn may explain the better postural performance found in Zumba group compared to Pilates group. However, Pilates training improved postural control only when standing on stable surface. Similarly, in postmenopausal women, Ibar Amazan et al. Found statistically significant improvement of the center of pressure means velocity in the firm surface condition, like our findings, after 12 weeks of Pilates training, suggested that Pilates training developed the proprioceptive system. Indeed, while performing Pilates, participants are engaged in a combination of muscle strengthening exercise like isometric, exometric, and concentric muscle contraction, stretching, and breathing contributed to an improved proprioception sensitivity and regulation of muscle activation involved in postural control. However, this improvement was not sufficient to compensate the effect of sensory perturbation. In this study, we face some limits that should be considered in further research. First, it would be important to evaluate other parameters like strength and mood. Also, assessing sensory inputs like vestibular and proprioceptive inputs would explain more clearly our results. Also, assessing function performance would be more pertinent to have more generative results. And finally, since the training effect may occur a few months after the intervention, it would be interesting to evaluate the protective effect of exercise. Finally, we concluded that 12 weeks of both Zumba and Pilates training program improved postural control in middle-aged women with more marked adaptation in favor of Zumba training. Pilates training seems to be an ideal exercise to improve posture control in these women only in simple posture conditions. However, Zumba training seems to be the most suitable and appropriate training program to promote posture control in both simple and challenging postural conditions in middle-aged postmenopausal women. Thanks to these findings, we recommended middle-aged postmenopausal women to practice Zumba training program for 3 sessions per week during 12 weeks period in order to improve their postural control. These improvements could offer greater potential in everyday functioning and reduce their risk of falls and injury, promoting their quality of life. Thank you for your attention.